If you are struggling to lift your arm above your head, or if throbbing shoulder pain is waking you up in the middle of the night, you are dealing with a soft tissue problem. Standard X-rays are great for bones, but they are completely blind to the tendons and ligaments that actually move your arm. A shoulder MRI is the gold standard for seeing inside the joint. It is the only way to differentiate between a frozen shoulder, a rotator cuff tear, or a labral injury before you commit to surgery. The most common issue we see, especially in patients over 40, involves the rotator cuff. These are the muscles and tendons that stabilize your shoulder. Over time, or due to impingement, these tendons fray and tear. On an MRI, we can see exactly how deep the tear is. Is it a partial tear that needs rehab, or is it a full-thickness tear that has retracted? Knowing this is the difference between months of physical therapy and an urgent repair. One of the most difficult diagnoses to make without an MRI is distinguishing between impingement and frozen shoulder. Both cause pain and stiffness, but the treatment is completely different. An MRI allows us to see if the joint capsule itself is thickened and tight, which confirms frozen shoulder, adhesive capsulitis. Or we might see fluid and inflammation in the bursa, which confirms impingement. If you treat a frozen shoulder like an impingement, you can actually make the condition worse. For younger patients or athletes, the pain often comes with a clicking or catching sensation. This usually points to the glenoid labrum, the soft, fibrous rim that acts as a gasket for the shoulder socket. Injuries here, often from sports or repetitive heavy lifting, destabilize the entire arm. An MRI allows us to inspect this rim for tears that cause chronic instability. To see the labrum clearly, we often perform a special procedure called magnetic resonance arthrography, or MRA. This involves injecting a small amount of contrast fluid directly into the shoulder joint. This fluid expands the joint capsule, allowing the radiologist to see tiny tears in the labrum or ligaments that a standard MRI might miss. If your doctor orders this, it is because they need the highest level of detail possible. We also use MRI to evaluate injuries caused by work, specifically from vibration tools or repeated forceful impact. Beyond trauma, the scan is vital for ruling out infections like osteomyelitis or detecting primary tumors in the bone and soft tissue. If you have unexplained swelling or pain that just won't go away with treatment, this scan provides the definitive answer. Aside from the joint injection, we may use intravenous contrast called gadolinium. Think of this as a highlighter for your blood supply. It alters the magnetic properties of water molecules to make inflammation, tumors, and infection glow on the screen. It is a safe, effective way to increase the sensitivity of the diagnosis and ensure nothing is missed. The shoulder is the most mobile joint in the body, which makes it complicated to diagnose. A misread MRI can lead to unnecessary surgery or a frozen shoulder that never heals. We provide second opinions for patients worldwide, reviewing your images to confirm if you really need that operation. Click the link in the description to upload your scan. Your mobility is your most valuable asset. Don't wait until it's gone.